Understanding Alzheimer's disease. This is an overview of the symptoms, the stages, and strategies for living. Physiologically, Alzheimer's is a disease of the progressive accumulation of plaques and tangles in the brain. It's a progressive loss of cognition, loss of the ability to think, to reason, to communicate, and eventually to function. Alzheimer's is the most common cause of dementia among people 65 and over. Statistics: 3% of all 65-year-olds are diagnosed with Alzheimer's disease. That percentage doubles every 5 years after the age of 65. 48% of the world's population of 85-year-olds will be diagnosed with Alzheimer's disease. Etiologies for dementia. There are many causes of dementia, Alzheimer's disease being the most prevalent, followed by vascular, multi-infarct, Alzheimer's disease from Parkinson's, Parkinson's disease, Lewy body, and many others. Americans with Alzheimer's. Every 71 seconds, someone in America is diagnosed with Alzheimer's disease, and by mid-century, this number will lower to one every 33 seconds. Currently, there's 5.2 million people with Alzheimer's disease in America, and as you can see by the chart, the frequency of Alzheimer's disease increases with age. History. Alzheimer's disease was first identified 100 years ago by Alois Alzheimer's. Little research has been conducted until about 25 years ago. Today, more tax dollars are allocated to the funding of Alzheimer's research than ever before. And the Alzheimer's Association was created to distribute information, advice, and support. This slide compares a healthy brain with an advanced Alzheimer's brain. Memory loss is the hallmark symptom of Alzheimer's disease. Also, difficulty making choices and difficulty with ADLs, or activities of daily living. Communication becomes difficult. There is a progressive loss of ability to communicate. Patients have difficulty communicating their needs, and it's also frustrating for caregivers and the person with Alzheimer's disease. What is Alzheimer's disease? It's a progressive disorder that attacks the brain and results in increasingly impaired memory and thinking ability, and also behavior. Alzheimer's affects memory, short-term memory first and then long-term memory later, judgment, which is the ability to make decision, cognition, ability to understand, learn, and process information, executive ability, ability to problem solve, and unfortunately the ability to care for oneself. Signs and symptoms of Alzheimer's include memory loss, confusion, impaired judgment, personality changes, disorientation, difficulty learning, and loss of language skills. There are 10 warning signs. I'm going to detail each. Number 1, memory changes that disrupt daily life. One of the most common signs of Alzheimer's, especially in the early stages, is forgetting recently learned information. Others include forgetting important dates or events, asking the same information over and over, relying on memory aids such as reminder notes or electronic devices, or family members for things when they used to handle on their own. What's typical? Sometimes forgetting the names or appointments but remembering them later. Number 2, challenges in planning or solving problems. Some people may experience changes in their ability to develop and follow a plan or work with numbers. They may have trouble following a familiar recipe or keeping track of monthly bills. They may have difficulty concentrating and take much longer to do things than they did before. What's typical? Making occasional errors when balancing a checkbook. Number 3, difficulty completing familiar tasks at home, at work, or at leisure. People with Alzheimer's often find it hard to complete daily tasks. Sometimes people may have trouble driving to a familiar location, managing a budget at work, or remembering the rules of a favorite game. What's typical? Occasionally needing help to use the settings on a microwave or to record a television show. Number 4, confusion with time or place. People with Alzheimer's can lose track of dates, seasons, and passages of time. They may have trouble understanding something if it's not happening immediately. Sometimes they may forget where they are or how they got there. What's typical? Getting confused about the day of the week or figuring it out later. Number 5, trouble understanding visual images and spatial relationships. For some people, having vision problems is a sign of Alzheimer's. They may have difficulty reading, judging distance, and determining color or contrast. In terms of perception, they may pass a mirror and think that someone else is in the room. They may not recognize their own reflection. What's typical? Vision changes related to cataracts. Number 6, new problems with words in speaking or writing. People with Alzheimer's may have trouble following or joining a conversation. They may stop in the middle of a conversation and have no idea how to continue, or they may repeat themselves. They may struggle with vocabulary, have problems finding the right word, or call things by the wrong name, such as calling a watch a hand clock. What's typical? Sometimes having trouble finding the right word. Number 7, misplacing things and losing the ability to retrace your steps. A person with Alzheimer's disease may put things in unusual places. They may lose things and be unable to go back over their steps and find them again. Sometimes they may accuse others of stealing. This may occur more frequently over time. What's typical? Misplacing things from time to time, such as a pair of glasses or the remote control. Number 8, decreased or poor judgment. People with Alzheimer's may experience changes in judgment or decision making. For example, they may use poor judgment when dealing with money, giving large amounts to telemarketers, and fall victim to scams. They may also pay less attention to grooming or keeping themselves clean. What's typical? Making a bad decision once in a while. Number 9, withdrawal from work or social activities. A person with Alzheimer's may start to remove themselves from hobbies, social activities, work projects, or sports. They may have trouble keeping up with a favorite sports team or remembering how to complete a favorite hobby. They may also avoid being social because of the changes they've experienced and feel embarrassed by it. What's typical? Sometimes feeling weary of work, family, and social obligations. Number 10, changes in mood and personality. The mood and personalities of people with Alzheimer's can change. They can be very confused, suspicious, depressed, fearful, or anxious. They may be easily upset at home, at work, with friends, or in places where they're out of their comfort zone. What's typical? Developing very specific ways of doing things and becoming irritable when a routine is disrupted. Here is a handy clinical tool that was developed by the U.S. Department of Health and Human Services, Alzheimer's Disease and Related Dementia Guide. Does the person have increased difficulty with any of the following activities? Positive findings in any of these areas generally indicate a need for further assessment for the presence of dementia. First, learning and retaining new information. Is repetitive, has trouble remembering recent conversations, events, appointments, frequently misplaced objects. Next, handling complex tasks. Has trouble following a complex train of thought or performing tasks that require steps such as balancing a checkbook or cooking a meal. Next, reasoning ability. Is unable to respond with a reasonable plan to problems at work or at home, such as knowing what to do if the bathroom has flooded, shows uncharacteristic disregard for rules of social contact. Clinical tool continued. Spatial ability and orientation. Has trouble driving, organizing objects around the house, finding his or her way around familiar places. Next, language. Has increased difficulty with finding words to express what he or she wants to say and following conversations. Finally, behavior. Appears more passive and less responsive, is more irritable than usual, is more suspicious than usual, misinterprets visual or auditory stimuli. In addition to failure to arrive on time for appointments, the clinician looks for difficulty in discussing current events and areas of interest and changes in behavior or dress. It is advisable to follow up with a family or physician. A physician or specialist will conduct an assessment. The assessment will be focused on the following: focused history and physical, brief neurological exam, blood work, functional status assessment, mental status assessment, depression assessment, CAT scan, and/or MRI. Alzheimer's disease can manifest itself in different individuals differently. The stages of Alzheimer's disease are progressive, from completely functional in the early stage to completely dependent in the late stages. Early stage shows very mild symptoms, and often the family doesn't even recognize. Middle stage is moderate symptoms, and late stage shows severe symptoms. Let's go through each of them briefly. The early stage can last anywhere from 2 to 4 years. A symptom of confusion, an example, may get lost in their own familiar neighborhood. Short-term memory loss may lose or misplace things. Poor judgment leading to bad decisions, may burn food on the stove or go out in the cold without a coat. Numbers can become confusing, may have trouble managing money and paying bills. Increased need for security, may be less likely to try new things. Mood or personality changes, may seem anxious, sad, paranoid, or even withdrawn. Language problems, may have trouble finding the right words to say. Taking longer to accomplish normal daily tasks, may get confused while dressing, not knowing which task to do next to reach the goal. And loss of spontaneity and initiative, unable to think or carry out an expected or unplanned idea or event. Middle stage can last 2 to 10 or more years. Symptom, increasing memory loss and confusion, shortened attention span. An example of this would be trouble with short-term memory and with learning new things. Long-term memory may still be intact and can talk about familiar things. Symptom, problem recognizing family or friends. An example maybe they would not even know people who visit. Symptom, suspicious of others or paranoid. Example, they may accuse caregivers or family of stealing. Symptom, they may need assistance with their activities of daily living. Example, they may require help with bathing, dressing, and toileting. Sundowning, increased restlessness, agitation, confusion, tearfulness in the late afternoon and early evening is very common. Language difficulties, may have difficulty expressing thoughts, feelings, and needs. Cognitive impairment, they may have difficulty with numbers, reading, organizing thoughts, and logical thinking. Perceptual and perceptual motor difficulties, they may have problems correctly understanding what one sees and may have difficulty with depth and distance, which can make them vulnerable to falls. Motor difficulties, they may have difficulty dressing self, walking, and understanding depth and distance. Changing in behaviors and mood, they may become more agitated when having difficulty with simple normal tasks, generalized restlessness, agitation, anxiety, tearfulness, and wandering. Hallucinations, delusions, suspiciousness, paranoia, and irritability. They may see and hear things that really aren't there and talk to people who may not be present. They may see those people as a threat to safety or their personal belongings. The late stage can last 1 to 3 years. Symptom, severe language deficit, may be unable to communicate with words. They can become incontinent with bowel or bladder, will not be able to control their bowel movements or urination. They become total need for care in their activities of daily living. They won't be able to dress, bathe, ambulate, or eat without help. They often develop a difficulty in swallowing and may choke on food or even drink. There's an increased need for sleep. They may nap several times a day. There's severe memory loss. All memory is damaged, no longer recognizes familiar things or people. They often experience weight loss because their body is shutting down. Seizures. The brain is severely impacted by the disease process and can trigger seizures. Skin infections and breakdown. Skin infections are generally related to poor nutrition and immobility. Groaning, moaning, and grunting. These may be the only means left for them to communicate their discomfort. These are the physical declines that you may see as the disease progresses. They start out walking steadily, then walking unsteadily, then needing assistance to walk, and then not being able to walk. They start out standing erect, holding their head up, and then they can't hold their head up. They start out feeding themselves with utensils, and then feeding themselves using their fingers, and then cannot feed themselves. They start out eating solids, and then they have to have their meals pureed, and then they can only take liquids. They start out being completely continent, and then experience the urge, but occasional accidents, use toilet with a reminder and assistance, and then become incontinent. They start out speaking clearly, making their needs known and understood, and then speak in monosyllables, and then speak in word jumble, and they cannot communicate with words, and then babble. Essentially, they go from independent to completely dependent. communication impairment in Alzheimer's disease, difficulty finding the right words, repeating the same word over and over, inventing a new word to label a familiar object, losing train of thought easily, words not organized logically, reverting back to their native language, using curse words that they never would have done before, no longer censoring themselves, speaking less often, and relying a lot on nonverbal communication. Here are some tips for coping with challenging behavior. Be patient. Show that you're listening and try to understand. Show your interest. Maintain eye contact. Offer comfort, reassurance, and encouragement. Give him or her time to complete tasks. Repeat the last sentence as a reminder to help them stay focused. Don't interrupt. It's only confusing for them. Don't criticize and correct all the time. That's also confusing for them. Just listen and try to understand. Try to find meaning in what is said. Don't argue. Just let it go. And be aware of the tone you use. Your tone of voice conveys your feelings and attitudes. Here's some more tips on challenging behavior. Use a gentle, relaxed tone of voice. A lower pitch is more calming and reassuring. Speak slowly, clearly, and in short, simple sentences. Don't overwhelm them with too much information. Give simple explanations, one thought or idea at a time. Give directions, 1 or 2 steps at a time. Give praise. Everyone needs to feel needed. And turn a question into an answer. Don't say, "Do you want your lunch now?" and say, instead, "Here's your lunch." In dealing with people with Alzheimer's disease, you have to enter their world. Don't expect people with Alzheimer's to function in your reality. You need to step into theirs. People who face memory loss and uncertainty need validation. Validation is a means of communication with confused, disoriented, or cognitively impaired people. It's a method of communicating that provides dignity and well-being by accepting them the way they are, provides unconditional acceptance and is non-judgmental, accepts meanings and feelings behind words, and allows emotional memory to return. Validation therapy. Number 1, determine and validate the feeling. Number 2, address the emotional need. And number 3, distract, redirect, or refocus. It's important to create a conducive environment for people with dementia. Be sure to have ample light. Eliminate dark corners and shadows. Use bright, contrasting colors. And often mirrors can become a problem. Your approach can also help. Don't sneak up from behind. Don't scare or startle. Don't tap on the shoulder, walk up from behind, or push a chair. Walk around and face the person face to face. Approach from the front. Keep your face eye level to theirs. So if they're sitting, you may have to squat down. Explain what you're about to do and use short, simple sentences. You should also try to create a failure-free environment. Replace criticism with praise and lavish on praise when a job is well done. Conclusion. Alzheimer's disease is a progressive loss of cognitive ability and the physical changes that accompany the brain deterioration. There are three stages of disease progression. Memory loss is a hallmark symptom. Loss of communication skills, loss of visual acuity, paranoia, and confusion are all very common. People with Alzheimer's disease are just like all of us. They still need to feel safe, protected, and loved.